KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wirtz. Today we're discussing early identification of symptoms of psychosis and schizophrenia in youth, teens, and young adults. Doctors have found for a first episode, the earlier the better to identify it and diagnose it as well as treat it. With us today, joining us, is Dr. Daniel Mathalon. He is running a clinical trial to address early psychosis in young people. He's professor of psychiatry at the Weil Institute of Neurosciences at UCSF, and he's principal investigator for a clinical trial, as well as the clinical director of the Path Program at UCSF. Thank you for joining us today, Dr. Mathalon.
Thank you for having me.
Why is it so important to identify psychosis in youth, teens, young adults? And what age does it show up at?
So the typical age of onset of psychosis and the disorders with psychosis are the adolescence and early adulthood. So the teens through the 20s. And historically in the United States, treatment for schizophrenia and related psychotic disorders really didn't kick in until patients had been chronically ill for some time, had declined in function, were unemployed, were on public health insurance benefits. There were really very few options for young people and their families at the outset of their first psychotic episode. At the same time, research, as you noted, was showing that the longer psychotic symptoms persisted without treatment and after a first onset of symptoms, the worse the response to treatment and the worse the outcome for the patients, which really highlighted the importance of early identification and diagnosis and early initiation of treatment to get the best response. With that came a recognition that in the United States, we had fallen far behind our counterparts in Western Europe and in Australia in terms of the access to care for early psychosis and efforts to actually preserve functioning rather than wait for patients to decline in functioning until services and treatments kicked in. Because of that insight, we've seen the development of early psychosis programs, sometimes referred to as coordinated specialty care programs across the United States. And the PATH program here at UCSF is one of those programs, really designed to create easy access for patients and families in the midst of their first episode of psychosis or even early warning signs of possible impending psychosis.
There's a family component in the PATH program. Why is that so important for patients with psychosis, especially young folks?
So we know that the family environment, especially for young people who are still very much involved with their families as they're starting to experience the symptoms of psychosis, can make a big difference in terms of their how they do and how they function. Helping families to understand what is happening to their loved one, to how to be supportive, how not to be judgmental or blame young people for the symptoms they're experiencing, can have a very big impact and positive impact. So our treatment approach involves not just treating the patient, but also the families and providing a lot of psychoeducation about psychosis.
What are you hoping to accomplish with this program and the clinical trials?
So the realization that early identification of psychosis and initiation of treatment could improve treatment response and outcomes. Starting about 25 years ago, the field began to ask whether we could identify young people before they develop their first episode of psychosis, at a stage when they're starting to see experiences that are psychosis-like. And by that, I mean things like hearing things that aren't there, seeing things that aren't there, maybe feeling suspicious about others, and having some disorganization in speech, but not yet fully being convinced about the reality of these experiences, that those individuals might be at increased risk for psychosis. And indeed, research was undertaken to establish criteria to identify these early emerging signs, and showed that indeed young people who meet these criteria are help-seeking, they're in some distress, but they're not yet fully psychotic. These symptoms are not fully in place as psychosis. And what we've learned from that research is that 20% of these young people are likely to progress to full-blown psychosis, which suggests that the criteria have some validity, that they do tell us about an increased risk. After all, the risk in the general population for developing a psychotic disorder like schizophrenia is only about 1%. So 20% risk over 2 years is a significant risk. However, we know that about 80% of these individuals will not transition to psychosis. And what we need now are treatments different than what we use to treat schizophrenia, different medications that have safer profiles, fewer side effects, and that potentially can treat young people experiencing these early signs and symptoms, and not only to improve the outcomes, but potentially even to prevent the transition to psychosis. The need for this has been recognized worldwide and has spawned an effort initiated by the National Institute of Health to fund a worldwide study that involves some 42 sites, including UCSF, all recruiting the same young people with the high-risk symptoms and following them over a 2-year period in order to set the stage for industry partners from pharmaceutical companies who are also invested in this research with the NIH, to begin to test novel medicines that could be helpful and address mechanisms of progression to psychosis and make a difference without introducing the side effects that the antipsychotic medications have that we use to treat full-blown psychosis and disorders like schizophrenia. So our hope is that we're going to see major new developments to help young people, and by intervening early, we may be able to substantially alter the course and even prevent psychosis in some cases.
And many times, folks that are initially diagnosed with an early psychosis do go on to have a fulfilling life, career, relationships. Is that right, doctor?
Yeah. So, we've had a certain bias in our healthcare system such that programs for schizophrenia have really been set up to treat the most chronically ill who've lost any ability to have income and insurance and things like that. What we fail to see by having that kind of bias in our healthcare system is the number of individuals who were functioning with schizophrenia but had private insurance. We're seeing psychiatrists and other professionals privately, but were not really being treated in centers that were specialized in care for psychosis. What we're hoping to have now is full court press treatment early in the course of treatment, before disability sets in, with the idea that we can prevent some of that decline in function and disability, and recognize that there is a lot of reason to have hope about being able to live a fulfilling life, to have meaningful work, to engage in pursuit of school, and to have meaningful relationships, even if one has been diagnosed with schizophrenia. And that is something that a lot of people aren't aware of, based on the biases that they have in mind about what schizophrenia looks like, from our emphasis on chronic patients with the most severe and disabling forms of the illness.
And it sounds like with so many programs working to the same end, it may help to eliminate the stigma. Thank you so much for joining us today, Dr. Mathalon.
Thank you. Thank you for having me.
Good luck with your studies. We've been joined today by Dr. Daniel Mathalon. He's professor of psychiatry at the Weil Institute for Neurosciences at UCSF, as well as principal investigator for a clinical trial and clinical director of the Path Program at UCSF. Thank you for tuning in. You've been listening to As Prescribed. I'm Alice Wirtz.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.